Health is a state of complete harmony of the body, mind and spirit. When your body or mind lets you down, your spirit struggles. At the Krishna Institute of Medical Sciences, we are dedicated to caring for your body and mind so that your spirit can shine. KIMS Group of Hospitals is spread across 6 locations in 2 states, serving around 60,000 inpatients a year. With over 2,000 beds across all locations, KIMS is the largest healthcare provider in Andhra Pradesh and Telangana. The flagship hospital, KIMS Secunderabad, is a 1,000-bed multidisciplinary facility spread over a massive 12 lakh square feet, making it an epic health city within the city. Over 2 decades, our aim has been to provide comprehensive patient-centric care. Led by a team of visionary healers, each department at KIMS is vital to fulfilling this goal. The heart of KIMS Hospitals is our Institute of Cardiac Sciences. This is one of the strongest cardiac centers in the country, led by a dedicated team of 40 cardiologists and 20 cardiac surgeons.
The cardiac surgery team in our group performs 15 cardiac surgeries, adult and pediatric cardiac surgeries every day. We achieved 99% success rate, which are comparable to any other country in the world. Our relentless effort by the entire team of cardiac surgeons, anesthetists, paramedical staff, we achieved this 99% success rate.
What we offer here is patient-centric, affordable care, and we have excellent support staff here, and we practice evidence-based medicine.
Our accomplishments as a group include 40,000 angiographies, 20,000 angioplasties and 25,000 open heart surgeries, including complex pediatric cardiac surgeries.
Most of the cardiac patients are suffering from the lung problems, diabetes, hypertension, neuro problems and renal problems. In spite of that, we achieved 99% success rate because at Krishna Institute of Medical Sciences, all the specialists are available 24 hours so that any complication that arises, we can treat immediately.
We do perform quite a few aortic surgeries at Krishna Institute of Medical Sciences for aortic aneurysms, which is ballooning of the aorta, and for aortic dissections, which is a tear in the aorta. We either do only surgery or a hybrid procedure, which is a combination of surgery and stent placement for these kind of complex scenarios. We have been performing these surgeries with excellent outcomes and minimum mortality and morbidity at Krishna Institute of Medical Sciences.
20% of our cardiac surgeries, they involve valvular surgeries. Among the valvular surgeries, the mitral valve, rheumatic are the majority. But in each and every case of non-rheumatic cases, we always try to repair the valve first rather than replacement, as we know the native valve is the best rather than a prosthetic valve replacement, which requires lifelong anticoagulation.
KIMS Institute of Cardiac Sciences at Secunderabad is a 200-bed unit with 10 senior cardiologists, 5 associate cardiologists and 5 senior cardiac surgeons that treat the patients with utmost care and love.
A patient who comes with the acute myocardial infarction, that is heart attack, is immediately taken to the cath lab. Once they reach the emergency department, the cath lab technicians, the doctors over there are informed that there is a primary angioplasty done, and we do, with all this process, we do meet the international standard.
And KIMS Hospital, we do a lot of emergency IIT aneurysm procedures, dissection of aortas, type A, type B, and ruptured aneurysms, who are leaking aneurysms, we do. We have expertise in doing these procedures.
KIMS is one of the few cardiac centers which has an exclusive division of cardiac electrophysiology and pacing. In this division, primarily we deal with arrhythmias, which are fast beating of the heart. We offer curative radiofrequency ablative therapies for these arrhythmias, which include simple arrhythmias like supraventricular tachycardia as well as complex arrhythmias like atrial fibrillation and ventricular tachycardia.
With expertise and technology, even the mindless details about heart disease can be found out through this echo machine, leaving nothing to chance.
Our facilities include 5 cath labs highlighted by a world-class hybrid cath lab, a 60-bed cardiac intensive care unit, five dedicated operating theatres and a 30-bed post-op recovery unit.
We routinely perform complex coronary interventions, aortic interventions, non-coronary and valvular interventions, device closures routinely with success rate comparable to any best institute in the world.
At KIMS, minimally invasive surgeries are regularly performed, especially for ASDs, valvular diseases and also coronary artery diseases. With this, recovery will be faster and patient can be discharged soon.
We at Krishna Institute of Medical Sciences offer a full range of services for heart failure patients. We do offer services for both acute heart failure and chronic congestive heart failure. We do have full range of services as in ECMO, both veno-venous for respiratory failure, veno-arterial for cardiac failures and sepsis. We also deal with short-term assist devices for crash and burn patients and as also for bridge to transplant. We also deal with long-term assist devices which can be a destination therapy or also as a bridge to transplant. And lastly, we deal with cardiac transplantation as well, which is on par with the transplant centers across the world.
We perform around the clock primary PTCA and angioplasty and stenting to heart attack patients, and also all necessary emergency procedures will be performed, and we take care of the patients with a lot of dedication and hard work, and so thereby we save many lives.
We have a cardiology department academic program running, and we do train people in cardiology, DNB cardiology training program, and also the PGDCC's cardiology diploma program. And we also run a fellowship program in cardiology for the general practitioners under the auspices of the IMA, that is Indian Medical Association.
Our long-term survival rate is comparable to any other countries in the world. 90% survival is 10 years and 80% survival after 20 years. The cost of cardiac surgery at Krishna Institute of Medical Sciences is affordable to any Indian citizen.
Our philosophy is treat with passion and care with compassion. Dedicated team is key to our success.
Our devoted doctors and support staff work in tandem to restore the happy harmony that is your health. Let our healing hands care for you.